Good day everyone. For today's video, we will be discussing about proton pump inhibitor, Raberprazole. Raberprazole, or what we called in the Philippines Acifex or Acifex sprinkle, suppress the secretion of hydrochloric acid into the lumen of the stomach. It is by inhibiting the hydrogen potassium adenosine triphosphate enzyme system on the secretory surface of the gastric parietal cells. This action blocks the final step of acid production, lowering the acid levels in the stomach. The pregnancy category of Raberprazole is B since there's no study that proven the risk of the drug for humans. Raberprazole is well absorbed from the gastrointestinal tract, have a half-life of 90 minutes and duration of 12 to 14 hours. Its bioavailability is approximately 52% tablet. Time to peak plasma concentration is 2 to 5 hours. Raberprazole is mainly metabolized in the liver via non-enzymatic reduction and to a lesser extent via CYP3A and CYP2C19 and distributed through plasma protein binding. Lastly, it is secreted mainly in urine. Raberprazole is contraindicated in patients with diarrhea from an infection with Clostridium difficile bacteria, also to inadequate vitamin B12 and low amount of magnesium in blood patients, also to patients with liver problems and a type of kidney inflammation called interstitial nephritis, also to patients with subacute cutaneous lupus erythematosus and systemic lupus erythematosus, to patients with autoimmune diseases and conditions of weak bones such as osteoporosis and broken bones. Also to patients with CYP2C19 poor metabolizer and to patients with hypersensitivity to proton pump inhibitor drug. The common side and adverse effects of Raberprazoles are fast heartbeat, general weaknesses, dizziness, vomiting, continuing ulcer or sores in the mouth, stomach pain, bloating of the hands, chills, and swollen glands. Before the drug therapy, the nurse responsibilities are to assess history of allergy to a proton pump inhibitor to reduce risk of hypersensitivity reaction, inspect the skin lesions, rash, pruritus, and dryness to identify adverse effect, assess neurologic status, including level of orientation, affect and reflexes to evaluate for CNS effects of drugs, inspect and palpate the abdomen to determine potential underlying medical conditions, assess for changes in bowel elimination and GI upset to identify possible adverse effects, assess respiratory status including respiratory rate and rhythm, note evidence of cough, hoarseness, and epistaxis to monitor for potential adverse effects of drug. During drug therapy, the nurse should administer the drug before meals to ensure that the patient does not open, chew, or crush capsules. They should be swallowed whole to ensure the therapeutic effectiveness of the drug. Provide appropriate safety and comfort measures if CNS effects occur to prevent patient injury. Monitor the patient for diarrhea or constipation in order to institute an appropriate bowel program as needed. Monitor the patient nutritional status. Use of small frequent meals may be helpful if GI upset is a problem. Offer support and encouragement to help the patient cope with the disease and the drug regimen. Provide thorough patient teaching, including the drug name and prescribed dosage. The importance of taking the drug whole without opening, chewing, or crushing it. Signs and symptoms of possible adverse effects and measures to minimize or prevent them. After the drug therapy, the patient should arrange for medical follow-up if symptoms are not resolved after 4 to 8 weeks of therapy because serious underlying condition could be causing the symptoms. So that's all for this video. I hope that you've learned something from the discussion. Thank you.